So with the round implants, they're always a smooth and a textured implant. With an anatomic implant, there is no smooth implant. There's only textured implant. The reason being is that Hello, my name is Hanjo Kim from A Plastic Surgery in Gangnam, Seoul, South Korea. I usually practice in Korean. I have my practice in South Korea. But I do have some foreigners coming in Korea for surgery. And a lot of them ask me if I can make YouTube videos describing the surgeries that I perform here. And that's my first step today. I'd like to talk about breast surgery. There's so much confusion over what kind of implants there are and what implants that we should use. And I want to simplify that procedure into what kind of implants there are and how to make decisions during this process. So first of all, shape-wise, there are round implants and there are anatomic implants. The difference between round and anatomic implant is that the round anatomic implant has a more natural shape. If you want a natural look, we'd obviously like to go with an anatomic implant. But the thing is, with Europeans and Americans, they like to have more of an upper pole fullness rather than having more naturalness. In that case, we can go with round implants, which has a more upper pole fullness and also is more soft to the touch. So in that case, we'll use round implants to get more of a contour that the patient likes. So this is the first decision that you have to make when you're thinking about having breast surgery, whether you want a round or anatomic implant. The second decision that you have to make is whether we want to have a smooth type of textured surface or a very textured kind of surface. So with the round implants, they're always a smooth and a textured implant. With an anatomic implant, there is no smooth implant. There's only textured implant. The reason being is that with the round implant, it can go in and it will turn anyways and you'll still have the same looking breast. With the textured implant, it adheres to the tissue. So there's no turning around of the implant. So if you put a textured implant in, be firmly there and softness-wise, it will not be very good. But in some cases, there are advantages to using a textured round implant. With the anatomic implant, we want the implant lower surface to be, the lower half to be at the bottom. So there's more fullness in the lower half. So the implant obviously has to go in this way. But with the anatomic implant, if you turn it medially, if you have more fullness in the medial or upper pole, it's not going to look very natural. So we obviously want to adhere this implant to the tissue, and that's why there is no smooth surface implant for the anatomic type. There's only textured. So the first decision that you have to make is whether you want to go with shape or softness, and if you want to go with a smooth type implant or a textured type implant. With each patient, there's always ups and downs. In some patients, a round implant will suffice. In some patients, an anatomic implant might be better. And so those are the decisions that I have to make with a patient coming in after seeing her tissue characteristics. But just for your understanding, before you come to our clinic to think about, those are the decisions that we make, the patient should make before and think about before surgery. Hopefully in the near future, I'll make more videos describing my surgery, different type of surgical techniques with rhinoplasty and breast surgery that I do most often. And if you have any comments, post below and I'll try to answer them to the best of my ability. Thank you.